Hello everyone, I'm Nandita Kapadia-Kundu and I'm a senior researcher for the Center for Communication Programs. Although I work globally, I live in Pune, India. I think theories and models actually are the foundation of our SPC work because they can guide the way we do and design our programs, they can guide our research, and most importantly, they help us identify constructs that are close to the context where we are implementing our program. And as you know, we work literally all over the world, and context is very important for us. So, no, to directly answer, no, they don't work the same in all settings. And let me give an example. For example, there are many theories and models related to information processing, and that is well suited to cultures that are individually focused, that like to do internal processing, that are comfortable with reading things and processing them in your mind. So they basically work well in Euro-American kind of settings. However, if you take those kind of models and apply them to settings which are really more focused on dialogue, on social norms, social networks, where the opinion of others actually counts a lot, then this whole thing of processing information is alien. And there then we end up with something called a theoretical flaw, because you are applying a theory that doesn't really match the cultural context of that community. And that's what happens. I mean, in many of our countries, our programs are designed to just provide information. And for a long time, and we have data to show that knowledge doesn't always lead to behavioral change. There's a limitation. But it's taken as a default setting almost, and it's as if theories are not well understood, so NGOs or governments tend to use a very basic, facile, one would say, version of the theory. And the concept of theory failure is on no one's horizon. I mean, if theory is on very few people's horizon. So, I'd like to appreciate the fact that we are talking about a theory session right now. There are many, it's amazing. When I came here as a student, and I'd lived in rural India in a village for 3 years. And I did this theories course at the School of Public Health. And I'm saying, it's not working out. The match isn't there. And then I had to choose a theory for my own dissertation. And I almost had a standoff with my advisor, because he says, you need a theory, to give your oral exam, and we can't let you proceed. I said, but I've not found anything that resonates. And then my advisor went off. He had a project to Bangladesh, and one day I went to borrow a book from his bookshelf, and I see this book, Eastern and Western Perspectives to Communication. And the book had like the Chinese perspective, the Japanese perspective, the Indian perspective, and I was fascinated. I said, there is so much out there that is not known. And I literally picked out a theory from that book which listed 5 principles. And I was evaluating a program where children were the prime communicators, change agents for an adult population. So it was a child to community intervention, and this particular theory had emotional response as a central principle and had the most sophisticated framework to study emotion. Because prior to finding this theory, I'd Google emotion and I'd get anger, guilt, fear, everything that was, like 20th century, 21st century angst. There were no positive emotions coming. And here was this theory that had like these 9 permanent emotions, positive, negative, they had accessories. And this theory was almost as old as Aristotle. So it's been around, but here's an emotional perspective on the eastern side of the world, and we have Aristotle on the western side talking about a rational. So that's how I first stumbled upon Eastern theories. And being at Johns Hopkins, which is a very empirical, science-driven university of public health, then even I got onto the bandwagon. And I said, instead of just evaluating this program where there were child change agents trying to promote hand washing with soap and prevent diarrhea, let me test this theory empirically, statistically. So it was another voyage of discovery, and I actually statistically measured every element of emotion. There is compassion, there are unequal flows of communication, which is so much part of Asian societies, which tend to be hierarchical. And when I ran all my statistical models, this theory called Sadharanikaran, which means simplification without dilution. So that's the essence of storytelling. We have, the Greeks had the Iliad and the Odyssey. In India, we have mythologies of the Ramayana and Mahabharata, where these tales are simplified to actually convey deep philosophical thought. And so I statistically, this theory ran away with the data. And it's amazing that even a place like Hopkins would allow me to use a theory of dance and drama that's 2,000 years old and test it. And then my committee at my oral exam said, Nandita, give me a promise. You will go to your university and teach when you go back, to take this theoretical work forward. But the children from that village were so with me. They had given me this dissertation and this huge wellspring of theoretical knowledge that I went back to that NGO. And then 14 years later, I have a second innings and I'm back with research. And now my mission is, you ask me again, I come again and talk about theories. It is actually an ancient model, but just I think it's about a couple of years ago that I discovered that Confucius was probably older than Aristotle, but I'm not remembering correctly, has the best theory on interpersonal communication. So if one segment of your program is dealing with interpersonal communication, whether it's at a community level or a health facility level, or say couple communication, then we can actually use the guidelines of Confucius. And the thing about Confucius as well as Sadharanika, the Indian theory, is that they show the flaws also. If it's there's inequity in communication flows, it's there because it's there in the society. Otherwise, you're going as if everything is hunky-dory and you think the couples are communicating beautifully when they are not, And very recently, data from Ethiopia told us that, whereas couples talk quite freely and some women even said they initiated their own conversations, the decision is always taken by the man. So there is inequity, asymmetry in that communication flow. And it's not going to occur to a program person, oh, I should be looking at inequitable communication flows. But it's so germane actually to that particular community setting. And I read this article by June Ok Young. She specializes in, Confucius and interpersonal communication. And she actually planted another seed, and of course, none of these Asian theories get published in mainstream journals. So I found her in some journal of communication. But she's introducing us to a new idea that we do not have to be constrained by our cultural boundaries, We can use Confucianism maybe in Baltimore City in projects. And she's taken this African concept of ubuntu and said, why don't we do something with Ubuntu and Confucius? So Ubuntu is, it has a concept of all of humanity and translates as I am because we are. And so it's the we actually that is the focus. And that's such a powerful concept. And that also links back to another new concept that I want to share with you, which is actually common amongst different theoretical thought, and that is one of shared compassion. So the shared compassion version of the Indian theory has a bit of the soul in sharing. There's no English translation because compassion translated by the Webster or Oxford dictionary means almost helping someone. But here there's an equal partnership and your souls are connected. And Ubuntu has it. Recently someone told me that it's one of the main tenets of Islam. And, and Buddhism has it, almost every religion has it. Every philosophy talks of it. And yet, we have not studied compassion, we haven't used it enough in our programs. And I remember 2 years ago at the Bali Summit, SBC Summit, I think the health minister or representative was talking about this several C's of communication. And I got up and said, let's add one more C, that of compassion. Because communication can't occur without compassion. Look at the hatred around us, the violence, the stigma. What is the antidote to that? It's compassion. And unless we are deeply compassionate and infuse our programs with that. So actually in one of our CCP programs, we are specifically actually trying to study compassion, trying to measure it and see how to include it in programs. So the situation right now, till recently, and still exists in many of our country programs, and I don't mean CCPs, but worldwide, is that there's such little theoretical knowledge reaching governments that are planning huge behavior change programs or other NGOs that are planning them, that the default mechanism is, okay, let's increase knowledge. Knowledge is the easiest to increase. Okay, social norms. So it is a challenge, but it can definitely be done. Promoting couple communication, it can be done. Promoting gender equitable norms has to be done if we want behaviors to change. So these are the new thinking that we have to move forward. And I think the change that has occurred when I was a PhD student and now is when I was a PhD student, it was like confrontational. Oh, this is East versus West, But now we are in a, it's a global, world. It's a global and local world. Media has changed. Our social media habits have changed. The way we access things has changed. And so we don't have to get, that, oh, this is Eastern or Western. Everything is local and everything is global and can be applied to our programs as we think relevant, So we want to, look at social networks within the US. Of course we can. And we could use a theory that may not be from here. So that's the new thinking. Yeah, I think one of the biggest barrier in using theory in SPC work is this very simple paradigm that I've spoken of earlier, that knowledge equals behavior change. It's as simple as that. The glass is empty, our heads are empty, fill them up with knowledge and a magic wand is waved. If only life was that simple. But we know it's more complex. And we know that there's a lot of depth. There are a lot of nuances in society that we need to understand, acknowledge, and then work with. And many of our theories provide us ways in which to deal with these complexities. But people always fall back on this, paradigm that, okay, let's provide knowledge. So I have seen in places with gender norms and they're focusing on that. And they're trying to focus on the knowledge of gender norms, which is totally inappropriate. So this I see as a big barrier. Secondly, I don't know whether at a donor level also it is required for us to use theories. Though now it is being increasingly, we are seeing that we are being asked to do that. And we've reached a stage where we can use multiple theories. And there's a theory called the socio-ecological model, which allows us to take a holistic view. Otherwise we're taking one slice of life. We're looking at just the couple and the household. But then there's a community surrounding that couple. Beyond the community, there is a health system surrounding the couple. Beyond the health system are policies surrounding, all of which are impinging upon that couple's decisions, options, choices. So with a model like socio-ecological model, we can actually look at all the slices, we can apply different theories to each slice, and we can actually put together a holistic picture. But all this has to be communicated with our programs, and I think if we can show them, we can demonstrate, programs will be more effective. I think we'll get so much more we'll get more bang for our money. That's such an excellent question, because I think to implement programs in the community, right, we're not lab-based scientists where everything is controlled. We are working out there, so there are going to be these socio-political, cultural, economic constraints that may pop up at any time of our programs. And the idea is that, we still implement our programs. We have to meet that challenge. And so taking into consideration all those constraints, we can still plan good programs theoretically, because if we choose an incorrect theory, then your program will fail and we will say there is theory failure. Very rarely do we attribute programs to theory failure, but had we given more thought, like this person has, then you want to select a theory or several theories in combination to most suit your context and your constraints. Because then you will be able to address some of these complex things that we carry as our cultural heritage and inheritance. It's just passed on. So I would encourage this person that look at it as a challenge, and a little later in this interview I'll be sharing with you how you can select theories. Keep your mind open and go ahead, try to adapt a theory. And adapting is not very difficult once you simplify the theories. And sadharanikaran means simplification without dilution. So our challenge also, as we try and build a bridge between theorists, researchers, and our so many colleagues that are doing wonderful work out there in communication programs, is to simplify our theories while retaining the essence, so that people feel comfortable using them, applying them. Yeah, so the first thing I would do, and very often is not done, because sometimes people get so caught up with the communication piece of the intervention. So, which entertainment media where will I be filming, which actress will I be getting? And they get really caught up in the creative aspect of this. But the first step I would do before I selected a theory would be list out the behaviors that my program wishes to change. That would be my step number one. Okay? Once I've listed out the behaviors, like for example, currently in Ethiopia, we are covering 6 technical areas, from malaria to nutrition to reproductive health, family planning, etc. So if I'm covering 5 or 6 different health areas, I would first list what is it that I want to change in these areas. Which human behaviors do I need to change? Once that is done, then I will look at which are the factors that influence these behaviors. Let me give an example. We have a problem of stunting in children under 2 in many of our communities. So let's take the example of nutrition. And one of the influencing factors that influences that undernutrition is number of meals that, say, a 7-month-old, 8-month-old, 9-month-old, 11-month-old may have. So I would list the influencing factors that influence this undernutrition. Okay? Now these influencing factors could also be, gender inequitable norms, as we've recently discovered. So women with gender equitable norms are more likely to feed their child more frequently. So once I have listed all these norms, influencing factors, so it could be access to resources, it could be couple communication, it could be transport issues, it also could mean a level of vulnerability, economic vulnerability. So after I've listed all these possible influencing factors, and I'd like to add one more thing. How do you identify these influencing factors? Very recently, for both the CCP's Bangladesh and Ethiopia programs, which are integrated programs where we're looking at 12 behaviors, 16 behaviors, when we do a baseline survey, we collect information on the behaviors and their influencing factors. And then we run what are known as logistic regression models to identify the influencing factors for each behavior. Now, for example, in Ethiopia, out of 16 behaviors, gender equitable norms were associated with 10. So that's a huge chunk. And normally if you go to a policymaker or even to a program manager, focus on gender norms, and she would say, where's the evidence, right? So here you say, okay, in your very own community, here is the evidence. So you're able to look at what are the influencing factors across so many behaviors as well as individual. So once you've done that and you know, then you select a theory. So if you know you want to focus on gender issues, you definitely want to take a good gender and power theory, or there are many out there. Or if you want to promote couple communication and IPC, go for Confucius. Or if you want self-efficacy, then you would go for Bandura. So even though I'm like a non-Western theory person, it's collective self-efficacy, self-efficacy. I always add Bandura. And the whole idea of vicarious learning. So, we have to kind of take different theoretical perspectives and amalgamate them into then guiding us into an integrated program. So, alright, let's assume that you've selected your behaviors, you've selected your influencing factors, and now you have to select your theory. Okay, I would say the next few things you have to think about is the cultural setting in which you will be working. So let's say if you're working in Africa, really be sure to include some theory that is socially based. So you can take social network theory, you can take social identity, you can take social capital, because I think in Asian as well as African, I would even say Latin American, our social context is very, very important. And so we are very aware of what others think of us. We are also very aware of, the fact that our decision making is influenced by, could be our neighborhood, could be a larger unit. And so I would see that, where is that locus, where is the center of that society? Does it lie within an individual? Does it lie within a small group? Or is it vast? It's very vast, and you can have everything. So if you have an individual focus, you'll go with a cognitive approach more. But you can also combine social and cognitive. So that's something to think about. The other thing is that what are the channels I'm using? Okay, and of course the most powerful way of communicating is direct dialogue or performance, because that has the most power. Then we have mediated contexts such as the telephone or the electronic media like TV, radio. So you have to see what you are using there. And now we are in a wonderful position where we can combine our mass media and IPC approaches. So, I would, if I'm doing IPC, I would look at something that is encouraging dialogue as well as a theory that explains how interpersonal communication occurs in societies. So you look at that, what are your channels and how is the best way to motivate. And of course you will look at, if I'm going to an area where, people are really excited about TV serials. So then you look at radio drama or TV, entertainment education. That's an obvious. And so there are several theories around entertainment education. So you do have to take a deeper look on the cultural context, on your audience, on your channels of change, and then think through it. Sometimes we are completely blinkered, and so we will say, no, I want to print posters. For World Malaria Day, I'm going to print 3 million posters. Okay? I'd say show me the evidence, that a poster has really helped change your behavior. If posters are going to be used in a well-coordinated campaign of which they are one small part, yes, they may have a role. But maybe there are other ways. How about digitizing your posters and having some discussion questions with it? Save paper also. So, that I would encourage people really to have fun with the theories. Not to be burdened by them and those technical terms and those researchers, yes. But have fun with them. Reach out to us, we would really love to connect. And enjoy your programs. Enjoy doing something different to improve the outcomes of your program. And I promise you theories will help you with that. Well, firstly, theory of change is a misnomer. It is not a theory. So it's more of an organizing framework. Once you get to the program level, it helps you organize different components. So, I've been in so many meetings where they say they don't know where the term theory of change came around. So, and the thing about a theory is it tells you how a certain set of constructs function to reach a particular goal. So that's a theory, Models and theory of change are really more organizing frameworks. So, and doing a 360-degree campaign, a public relations campaign for an entire country is a challenge, and it would really depend what the campaign is on before you select your theory, which cultural context you are working in, where you select your theory. No, please throw IEC in the dustbin. Let's retire it. In the 21st century. Okay? Let's move forward. And I'll tell you some of the drawbacks of IEC. IEC is information, education and communication. And at the time, and especially in the 70s, 80s, even 90s, when it was in use, the entire focus was, let's prepare materials, And that was your magic bullet. And we know that materials are not going to change behavior. We are human beings, we are complex. And so slowly we realized just putting up a poster, maybe even in a health facility, most people walk by without even looking at it. Unless you do a facilitated tour of that poster, it's quite likely that it's not even going to register here. So I think keeping the focus of your behavior change effort should be on understanding which behavior you want to change, how you want to change it, and how you can accelerate that rate of change and you can amplify that rate of change. So those are the questions that we should be looking to answer. And to answer those questions or to reach those levels of outcomes, IEC is not a tool that we will use. You can look at SBC, you can look at uh, ways to persuade someone. You can look at digital tools which is giving us, suddenly a way to exponentially reach people even in remote areas with a combination of dialogue and mass media through our mobile phones. It's a boon and a bane. So let's accept it. So let's leverage it for the purpose of changing health behavior. So we must leave IEC behind. I think a good resource should be our own K4 Health resources and our CCP websites. Another good resource is the Eastern and Western perspective to communication, and people who want to get access to it or its chapters, it's not available, but it's with Popline. And the name of the book is Eastern and Western Perspectives to Communication, edited by Larry Kincaid, 1987. Some of this newer thinking, and there is quite a literature actually on the global theories. So I can ask some of my colleagues also. So Latin American, Paulo Freire, and this whole thing of participatory programs and approaches, critical thinking, pedagogy of the oppressed. These are classics, and now we do lip service to participation. It's a deep process, it's just, I will do the participation. I've done this qualitative research which is participatory. No, it's not. We have to go back to what the essence is. I Googled because my main area was this mainstreaming of global theories. So I found this African theory, a Pen 3 model, because I said there has to be something, and that has been published in the Journal of Health Communication. So I put African communication theory and something popped up. So because we organized a panel at our Addis SBC summit, and so we presented African, Asian, Euro-American or Western, and Latin American. And then suddenly someone in the audience said, but what about this Middle Eastern Islamic perspective? And I said, yes, the next time we do it, that's what we're going to add. So we tried to find resources from all these areas. Yeah, I'd like to really give a strong message to the users on Springboard to start thinking about global theories of communication and how we can mainstream them. Because we have a huge body of literature on the cognitive theories of communication. There's a big literature, there are critiques of critiques, there's big documentation. After that come the Asian theories, which have a few journals. After that we have the Latin American ones, and then the African. So please try and explore these. Get in touch with us, and we are happy to engage with you. If you want to apply this to your program. But try and think out of the box, try and chart a new pathway, and let us know what you've learned.